Paget's disease of bone is a disorder in which there's a lot of bone remodeling that happens in one or more regions of the skeleton. Typically, there's an excessive bone resorption followed by excessive bone growth that leads to deformities and fractures. Paget's disease of bone is not a rare disease. It is the second most common metabolic bone disorder after osteoporosis. It is uncommon before the age of 40 to 50 years. The disease is most common in white people of European descent, whereas it is rare in people of Asian descent. The peculiar and unique characteristics of bone affected by the disorder is represented by abnormal exaggerated bone remodeling activity. It is believed that the osteoclasts, the cells responsible for absorbing bone tissues during remodeling, are the primary sources of the disease, while the osteoblasts remain normal. First phase of the PDB is called osteolytic phase. In this phase, bone resorption becomes predominant, leading to the deterioration of bones, especially the long bones such as the femur and the tibia. The second phase is the abrupt and chaotic formation of new bone tissues at greater rates than normal. The newly deposed collagen fibers are then laid down in a disorganized rather than a linear fashion. The third phase is the burnout phase of the disease. There is no longer any evidence of increased turnover of bone tissue. In this phase, there is an enlargement and widening of the bone. Patients who have PDB are asymptomatic, they show no symptoms in the early stage. Localized bone pain is the most common symptom of the disease. Its source of pain is increased vascularity, distortion of the periosteum, focus of mechanical stress, first phase of PDB, irritation of nerves covering the affected bones. Patient who have the disease shows complications like osteoarthritis, periarticular pain, muscle pain, and neurological syndromes. The most serious complication of the Paget's disease of bone is the neoplastic degeneration. Neoplastic causes tumor growth. Majority of these tumors are classified as osteosarcomas. In most cases, the diagnosis of the Paget's disease of bone is based on the combination of symptoms together with the evidence of increased bone turnover markers and the presence of typical radiological features of the disease. Vitamin D deficiency or hyperthyroidism have been described in Paget's disease of bone. Serum total alkaline phosphatase is the most widely used and recommended biochemical marker for the diagnosis.